So, welcome, Dr. Megan, to SoloMoms Talk. And we're going to talk about health. We're going to zero in on the health of the solo mom, physical health. PT is one of your specialty, right?
Yeah.
So to kick this off, I'm going to tell you that I've been hit by a car in a crosswalk, and I've been rear-ended by a car. And to kick off, I want you to tell us how that affects the body, and in particular, when we don't pay attention to it.
Yeah. Well, first of all, thank you for having me. I'm really excited to be here and chat a little bit with you. And secondly, I'm sorry that someone hit you in a crosswalk. Oh my gosh, that's awful. Oof. Yeah. That kind of stuff happens, unfortunately, and not much you can do to prevent that kind of thing from happening. But after accidents, there is a lot that you can do to kind of get your body back to healing. I work a lot with athletes. I work with people that have had surgeries. I work with people that have been in injuries or accidents, car accidents, slip and falls, things of that nature. And something that kind of goes through each person, kind of that common strand, is the fear, right? So when you first get injured, there's a lot of questions in your mind. You don't know how long this is going to take for me to overcome. You don't know what you're going to have to do to overcome it. Put that on top of all your daily responsibilities, especially being a mom. What are you going to do if you're injured and you can't walk, if you can't take your kids to soccer, or you can't take them to school? How are you going to get through your daily? It's my job as a PT not only to help you kind of navigate those waters, but also give you the tools that help you to kind of speed up your healing process. And with that fear, that's usually something that holds a lot of people back from healing. For example, I saw a patient the other day that had an accident, slip and fall accident, and she's been very afraid to even move her leg around, probably for the past month and a half. And when you aren't moving for that long, your body kind of forgets how to do that. It forgets how to move the right way, and anything that you do, your body feels like it's hurting itself, if that makes sense. So after an accident or injury, you go into this, the fight or flight mode kind of thing, and everything's trying to protect itself. Your body's trying to protect itself. That's natural. But after a few weeks and those tissues start to heal, your brain is still in that, okay, we have to protect ourselves, so we're not going to move mindset. And when that happens, and if you don't start to move, like with physical therapy, graduated movement and making sure that you're on the right path, then you can get what's called things like complex regional pain syndrome, where anything that you do is going to irritate your tissues and cause inflammation. And then it just kind of trickles down from there. Mental issues, you can go into depression. There's just a number of things that, could go wrong after you get in an accident or an injury.
Right. And what are some of the things, if you could tell us, what you do to address the issues of whether it's a muscle injury or skeletal injury?
Yeah, so as a PT, I go through what I call a movement assessment. In my line of work, since I have my own clinic and everything is one-on-one, I get a lot of time to actually talk with the patient, find out what's actually going on, and then take the time to move through a whole assessment, versus sometimes when you go into a physician's office, they only get 5-10 minutes with you, and it's like, let me write you a prescription for medicine and hope you feel better kind of thing. So I would definitely encourage anyone that's been hurt, injured, or just has questions about injury or scared about an injury to see a physical therapist first, especially if direct access is around, which means you can just come in like after you got hit by a car. Obviously, if your injuries weren't like so bad, you'd go, to an ER or something like that, but you could come into physical therapy and we could let you know, okay, this is something that we can deal with. If it's out of our scope, then we have that access to be able to send you to an orthopedic or a neurologist, or, to the ER hospital. And oftentimes you'll get in a lot faster because you've already seen us first. So when it comes to, muscular injuries, skeletal injuries, bone breaks, things of that nature, it just really depends on how bad it is and, the time between when it happened and when you come in. So sometimes with chronic injuries, it takes a little bit longer for PT to kind of get back to moving again. With acute injuries, it doesn't normally take quite as long, just depending on what it is.
Right. Okay. Can you tell us any more about how someone wouldn't like, so I was injured a very long time ago. But the other day, during lockdown, I was I was not moving as much, and I
Hmm.
started to feel this pain creeping up on me. Like, what do you do in those situations? Do you consult someone like yourself to, I mean, of course you might consult your doctor first, but it's a pain, and you kind of figure where it's from. So would we come to you first, and what would you do, to help us in that situation?
Yeah, absolutely. More often than not, our bodies want movement. They want some kind of activity. Sometimes, especially in this day and age where we can work from home now, we're on our computers a lot, and then our bodies start to hurt, and, our posture is not the greatest, and things start talking to us that weren't talking to us before. But one thing I would tell people just right off the bat is move around a little bit. So whether that's setting an alarm in your phone, sometimes I'll tell my patients, set an alarm in your phone for every 30 minutes, at least get up, do a little stretch break, do a little chest stretch the hamstrings, stretch the back out a little bit, 5 minutes. And then get back to, your work's still going to be there, your job's still going to be there 5 minutes later, but let's just get moving a little bit. If it's something that continues to nag you or is getting worse, yes, definitely speak to a healthcare professional. As far as physical therapists go, myself, I do consultations online, free online consultations. So even if you weren't in Florida, for example, you could set an appointment with me. We'd have a small conversation, figure out what's going on, see if that's something that you need to see someone else for, or if it's something that we can resolve with physical.
Okay, cool. And I'm a big fan of the standing desk. And
Yeah.
now that we're working from home, we have a lot of place to stand at, but yet I find myself sitting a lot. So I'm thinking that because I can sit, right? I'd like you to address this sitting and how it relates to physical, the health that would deteriorate and needing us to need your services. Follow me?
Yes.
Okay.
Yeah, I get you. So sitting in itself isn't necessarily bad, right? Anything that you do to excess can not be good for you. So same thing with sitting. So when you think about if your body's in the same position for 6, 7, 8 hours and you're barely moving, or the little bit that you're moving is just a shift in your seat somewhere, you're not really getting a ton of blood flow, a ton of movement throughout your body. Our muscles, they need oxygen to be able to move. They need that blood flow. So think about if you're, sitting on your foot or you're laying down on your arm and your arm starts to go tingly, right? That's because those nerves and the muscles, they're not getting the blood flow that they need. They're not getting the oxygen that they need. So they're telling you, they're kind of sending you the signal like, hey, not getting what I need. I need you to move around a little bit so this tingly goes away. Same thing with your body. When you're shifting around, that's your body telling you, hey, I need some blood flow. I need some movement. Let's do something a little bit different. So again, if you're finding yourself sitting more often than not, definitely set an alarm in your phone. And once you kind of get used to that of not sitting all the time, then you'll start to get in this habit of where your body automatically wants to sit up taller, or you want to stand up and use your standing desk or whatever it is, because now your body's used to more of that movement.
Right. Anything else?
I think, just in general, especially as a single mom, I know that it can be difficult sometimes to find those times for yourself to exercise or to be active. But just think of it as you are literally being active in everything that you're doing with your children, right? Whether that's bending down to pick them up, whether that's holding them on one hip, whether that's, reaching things in the cabinet to clean or to put dishes away. Anything that you do movement wise can be turned into, so think, all right, if my kid constantly wants me to pick him up because he's crying or something like that, how can I make this kind of like an exercise? I can squat down, get in a good posture, hold my stomach muscles tight, pick him up, bring him above my head, bring him in front of me, bring him down to the ground, bring him in front of me, bring him up, that kind of thing. So it's just kind of incorporating things into your day that you're already doing, thinking of it in a little different mindset. And sometimes just changing that mindset of things, you will see a complete difference in not only your physical self, but your mental self, your emotional self. And, and it makes things a little bit more fun and less frustrating when the baby's crying too.
Yeah. Okay. One idea or thought for a woman who's pregnant, and two for a woman over 50.
One, for a woman that's pregnant, keep moving, keep exercising. There's tons of research out there that exercising throughout your entire pregnancy helps, not only yourself, but your baby, and then also your recovery after birth. So sometimes women get SI joint issues a lot with pregnancy, and that's basically because the pelvis has to start opening up for when they are going to have the baby. Things like a SI joint lock belt really, really help, especially if you're active and you're moving around. So don't be afraid to use some of those things that help give you a little bit more stability during pregnancy. And then women over 50, if you haven't worked out all your life and 50 is the year that you decide you want to do something, more power to you. Like, definitely get on it, because there is never a time that's too late in your life to start being active, to start moving around, and your body and your mind are just going to thank you that much more as you go in through your life.
Thank you for explaining that. And it seems like exercise and physical therapy go hand in hand. One prevents the other, right?
Definitely.
Okay.
Yeah.
All right.
And with physical therapy, don't look at it as I have to be injured to go to physical therapy. Look at it as from a wellness perspective too. So if you're having struggles or questions and things don't feel right, definitely talk to a physical therapist so that they can make sure that you do move right, so that you can prevent those injuries from happening.
Okay. All right. I appreciate that. And can you tell us about your business? How can someone get in touch with you, and what can you do for them?
Yeah, so again, I have my own clinic. Everything is one-on-one with a doctor of physical therapy, so either myself or I have a colleague, Dr. Rachel Peters, as well. And we do everything in office. We also do things via, Skype or Zoom. So if people have questions, I do free consultations. They can go to my website, www.bodymechpt.com, and check out scheduling from there. You can also check out my other website, www.Meghan, Meghan Braun, Braun.com. I know it's confusing, but there you can get a hold of me as well and see some of the speaker stuff that I do. And then also social media at BodyMech.
Okay, I'll put those in the show notes too, so people can access them.
Find it easier.
Thank you very much, Dr. Meghan, for coming and speaking to us about physical therapy and taking care of our bodies. Good, thank you.
Yeah, thank you. I'm glad to be here, and hopefully some of the info I shared will help out some of your listeners.
Thank you.